The early part of my career really was in clinical practice, in hospital settings and community settings. I became pretty struck early on that it would be much better to prevent problems occurring rather than to treat them once they were established. But the opportunity to do a PhD really coincided with the early phase of Basil's marriage to my mother, so that was how he came to be really influential in encouraging and facilitating that. So Basil also had an Adelaide base, and coincidentally 2 of his sons are about my age, so I had known his sons when I was a teenager, none of us never ever contemplating that we would one day become step-siblings. But my father died young. My mother was widowed in her 40s. And Basil's first wife, Helen, also died young in her mid-50s. And so these 2 people were widowed, but both had large families and both had very good first marriages, enjoyed long-standing relationships. So they were reintroduced by mutual friends in the early 1980s, in 1983. And had a pretty whirlwind courtship and decided within 6 weeks of re-meeting each other that they wanted to get married. But in terms of Basil's assistance to me, he really encouraged me to do a PhD. Well, I'd have to say I think Basil is a very enabling and influential person, and having had the opportunity to have lots and lots of conversations with him about the potential powerful impact at a population level of public health approaches has certainly been very influential for me to take my area of interest and apply it in that way. And probably for my daughter, it's been a similar process in that Basil's the only grandfather she's known on that side. She was born well after my father died, so she has heard him talk publicly. She's had, of course, hundreds of conversations with him. He's taken a great interest in her because she did her training in medicine at Monash, and he was very pleased about that and has encouraged her to think about combining research with her interest in being a specialist clinician. So I think our relationship with him has been a very formative one for both of us.
My grandfather Basil usually takes centre stage whenever we're at a big dinner together, and he's usually pretty good at delivering a lecture, often about iodine deficiency to the family. And I think also it's great in inspiring new ideas and new directions. So for all of us to sit around a table together and discuss our work and to have input from my mother as a professor and my grandfather as a professor, to have their input into my work and to hear their ideas is really quite special, and I'm sure it improves my work and my understanding of public health as well. The decision to do a PhD probably has a number of influences. Certainly I've been exposed to this academic world through my mother and through my grandfather, and so I've always been aware of I suppose what it involves and what you can achieve through public health and through an academic career.
You see, the disease arises, say, in the mountains in New Guinea because the soil has been washed of iodine over centuries, and whatever they grow is deficient, and they're on sweet potato and taro, and that is, of course, nutritious, but there's no iodine in it. So they're locked in, you could say, in an iodine-deficient environment with subsistence agriculture. The IDD idea was new, and of course it bypassed the problem of goiter, which had dominated, to my surprise in retrospect, completely dominated the interest of these very distinguished people. The 2 outstanding leaders in research in thyroid work was a professor at Leiden, a Dutchman, Corrido and Stanbury in Boston at Harvard. They were undisputed big names, but they were biochemists. They were oriented to mechanisms of disease. And that, of course, was important, but it needed, you can marvel at the fact that these cretins were running around for years without anybody doing a study of the control trial, until we did it in New Guinea. And I introduced epidemiology, which is I was a new boy in epidemiology, particularly associated with the chair at Monash. Some of the people in CSIRO were dead against epidemiology, full stop. It is a different discipline. You're dealing with numbers. We presented at the international meeting in Vienna in 1970. It was a big moment, but I could see it. People were sort of shocked to a degree about this, and it was very new. That the basic point was that women, the condition of cretinism, was due to iodine deficiency in pregnancy, affecting the brain, development of the brain. That was pretty new stuff. But the fact that it was published in the Lancet with support in an annotation gave it the necessary base, in a word. The people there had been studying the problem for a number of years, and again, it was the first controlled trial really ever done.
Both my grandfather and my mother and other members of my family, they're extremely humble, but they're all extremely high achieving, and certainly in a public health sphere, my grandfather and my mother have made enormous contributions, and that is hugely inspiring for me, just starting my career. And I think they're really amazing researchers, and it's been fantastic and a great privilege for me to grow up in this environment. And I'm sure if I hadn't have had that experience of sitting around a dinner table, listening to those conversations, listening to what they've done and where they've travelled to and who they've met, I'm sure without that experience and without that sort of underpinning support, I wouldn't have had the opportunity to do what I'm doing today.
I think his work definitely exemplifies the power of prevention. So to make an observation about a risk factor that maybe you could change, then to implement, which he did with this extraordinary program of laboratory science, epidemiological research, testing and clinical trials, he demonstrated that if you could alter that risk factor, you could alter the outcome, which was really remarkable.